So I tell patients all the time that I think one of the most important things in terms of knowledge is knowing what your options are if you do in fact need to be treated, because it's not a one-size-fits-all. And I find too many patients that are only offered hysterectomy, open surgery. It's gotten better. I mean, in the 25 years I've been treating fibroids, it used to be much more common where I would hear, well, you know, just take out the uterus, you're done with it, you're done with your children, just take it out. Which hysterectomy is still the best option for some patients, but fortunately for patients, there's a lot of other options available today. And a lot of them are a lot less invasive with a lot less recovery time. I mean, traditional hysterectomy is 4 to 6 weeks of complete recovery. Who has 4 to 6 weeks to take off of your life? You know, and then some people, even if work is not a problem, it's caring for children, it's caring for parents. I mean, there's a lot of social reasons why patients can't do that as well. So fortunately today there are a lot of other options, but there are minimally invasive surgical options. There are robotic surgery, laparoscopic surgery, hysteroscopic surgery, which are all less invasive ways to either remove the uterus or remove fibroids from the uterus through less invasive means. So smaller incisions, therefore shorter recovery times. About half of the traditional recovery time is open surgery. So rather than 4 to 6 weeks, like 2 to 3 weeks. There are some thermal ablation technologies out there that exist where they can heat and kill fibroids with heat. Acessa, Sonata, usually used in conjunction with one of the less invasive surgical options. There are better drugs and medications than we've ever had, with more coming out all the time that can be very effective in controlling symptoms related to fibroids. The trouble with most drugs and medications, both hormonal and non-hormonal, is that their effects tend to be temporary. So they work pretty well for most patients when they're on them, but as soon as you come off, the symptoms generally come right back. And then many of the medications, especially the hormones, there are limitations to the amount of time a patient can take them, and there are also significant side effects for some patients as well. As I mentioned, still the traditional surgical options. And then my practice is dedicated to treatment with fibroid embolization, which is basically a catheter-based, minimally invasive treatment option. It's done much like a heart cath type procedure through a tiny puncture hole in an artery. What we do basically is we cut off the blood supply to the fibroids and cause the fibroids to shrink and die with a significantly less downtime, less recovery time. Love doing my procedure, but I tell patients all the time, it's not the best for everybody. I realize that. So that's why I feel like every patient that comes in, my goal is, I always say that my primary goal in today's meeting is to educate, provide information, answer questions. And if you're a good candidate for my procedure, I'll tell you. And if I feel like you're served better by something else, I'll be the first to tell you that as well. But too many physicians out there only offer what they do. They only talk about what they do. They don't talk about things they don't do. And that's how we try to be different.